Hello, I'm Dr. Jerry Mixon from Longevity Medical Clinic. Today I'm going to be telling you a little bit about how we at Longevity Medical Clinic go about lowering cholesterol without resorting to the statin drugs. But let's talk a bit about cholesterol. Cholesterol is not bad. Cholesterol is critical for life. Without adequate cholesterol levels, your brain, your muscles, your heart, your kidneys, nothing works. So if you had no cholesterol, you'd be dead. It's that simple. But when cholesterol is damaged by sugar, free radicals, any number of items, cholesterol is then perceived by your body as a foreign agent because it's no longer the original product. LDL cholesterol, unfortunately, is fairly fragile, and a lot of things can harm it. So it then gets sequestered into the walls of your arteries, forms plaque, that sets you up for heart attacks, strokes, high blood pressure, pulmonary embolisms, etc. We need to keep your cholesterol within a reasonable, healthy range. What most people don't realize is that cholesterol is, in fact, the mother hormone, and I talked about that in a previous video. All of your primary hormones that are necessary for a healthy, active, vital life are made out of cholesterol. So we want you to have cholesterol, we just don't want you to have too much of it, all right? In our youth, our adrenal glands, a woman's ovaries, the men's testicles, our kidneys, all sorts of organs are able to use cholesterol to make what we refer to as the terminal hormones. And those terminal hormones are primarily pregnenolone, dehydroepiandrosterone, progesterone, testosterone, estradiol, and cortisol. Those 6 are the biggies. All right, all made out of cholesterol. In our youth, our organs are very good at using cholesterol to make the hormones that they're supposed to be making. But as we age, those end organs are going downhill. They're not working as well. Ovaries start wearing out, testicles start wearing out, adrenals don't stay healthy forever. And so what happens is your blood levels and tissue levels of all those critical hormones start declining. And as they decline, we need to try to get them back up. And your body sees that it no longer has enough of pregnenolone, progesterone, testosterone, estradiol, dehydroepiandrosterone, cortisol, etc. And so it starts ramping up the production of cholesterol in an effort to drive those reactions forward. Your body doesn't seem to understand that it's the testicles and the ovaries and the adrenal glands that are going bad. It raises your cholesterol level. Unfortunately, it doesn't work because no matter how high your cholesterol levels get, those tired, older organs are simply not able to do their job as efficiently as we'd like. What we do at Longevity is we give you back all of those hormones, not just 1 or 2 of them. We measure them all about every 3 months, and we give you everything you need to bring all of your levels back to a healthy, robust, youthful level. When your body sees that you have enough of all of those hormones, it no longer has to drive the cholesterol so high. So what we find is the vast majority of our patients is that once we get their terminal hormones back to a healthy, youthful level, cholesterol becomes very easy to control. Then just dietary, lifestyle, exercise, weight loss suddenly becomes very efficient at bringing those total cholesterol levels down to where they ought to be. There's always that few people, that 5 or 6% of folks that it doesn't work. They may be genetically coded differently than the rest of us. We are a combination of environment and genome. But at Longevity Medical Clinic, we will use the statins, and those few people we have to. But the vast majority of the time, we don't have to worry about the statin side effects and the problems because we get cholesterol down by bringing the hormones that your body's trying to make up. Now, when you've got all of those youthful hormones, your body functions better. You're now stronger, faster, leaner, smarter, sexier, which makes most people much happier. And that's the core, the base level of what we do at Longevity Medical Clinic. Now, that's not all we do, all right? But that's our base. That's where we start. And beyond that, well, we have a whole lot of things we can do to make you live a longer, stronger, healthier, happier life. If you really want to know what can be done, well, you can watch more of these videos. They'll give you some ideas. Or, better yet, come on to Longevity Medical Clinic and become a patient. Let us make you stronger, faster, leaner, smarter, sexier, and happier. What's wrong with that? Thanks for watching. Bye-bye.